So, hello everyone. Welcome back to our series of the patient interview. This is the sixth part, the sixth component. My name is Fatima Akili. I'm also a medical student at the Stritch School of Medicine, and I am one of the co-founders of the Medical Arabic program.
Marhaba everyone, my name is Rand. Like Fatma, I'm also an M3, one of the co-founders of Medical Arabic, and we're so excited that you're here today, and we hope that you benefit from our videos.
Yes. So today our discussion is going to revolve around the psychosocial history. In particular, the psychosocial history tells us a lot about who the patient is living with, their daily habits, what they like to do, and what things could be impacting their health beyond the surface level that we're used to or beyond their history of present illness. So it's a very important that you learn a little bit of pieces of information, or you learn how to discern or ask the questions and be culturally sensitive to those patients in order to be able to obtain as much information as you can. And we will be guiding you through that today.
Okay, so starting off with some basic terminology. So this table just has some basic family members. So over on the left side, we have obviously the English, and then we have in the middle column how it would be pronounced using English letters. And then furthest to the right is the column using Arabic. So feel free to repeat after me. I'll just go one row at a time. So mother is father eb, sister ukhut, brother akh, husband is zawj, wife zawja, and here you can see basically like the spouse is the same word, but the wife gets a little bit of an eh sound at the end. So zawj for husband, zawja for wife. Son is ibn, daughter is bint, friend, if it's a male friend, then you say sadiq, and if it's a female friend, you say sadiqa.
Okay, so we will be also talking about how are they related. So the way you would ask that is inta murtabit, or inti for a female, murtabita, which means are you in a relationship. Married is mutazawwij, and for a male. For a female, it's mutazawwija. It's the same sound that Rand was introducing earlier, the ja. So mutazawwij for a male, mutazawwija for a female, that's married. For single, azab for male, and then for female, azba. It's a little bit difficult, but you could say azab, azba. And in a relationship, mi is murtabit, and it comes literally from the word to mean tied. So murtabit means you're in a relationship.
Okay, so this one is asking, who do you live with? Again, same setup as last, or I guess this time it's a little bit switched. It's on the opposite. The left side is English, middle is how it would be pronounced, and furthest to the right this time is Arabic. Okay, so whom do you live with? Btuskun ma'amin. So btuskun means to live, and then ma'amin means with whom. So in Arabic, it's kind of like the words are flipped. The order of the words are flipped in Arabic versus English. So btuskun ma'amin is who do you live with? And then the patient would answer, I live with my, which means beskun ma'a. So beskun means I live, and then the word ma'a means with. So beskun ma'a, so I live with. And then wife, zawjati. So the patient might say beskun ma'a zawjati. Husband, zawji. Children, awladi. So the patient might say beskun ma'a awladi. Roommate is Zamil al-Ghurfa, and that one is a direct translation from the English word. So room is Ghurfa, and then mate is Zamil. So it's a direct translation, Zamil al-Ghurfa. And then I live alone is Beskun lahali. So lahali means alone.
Okay, so now moving on to employment, asking them if they work, which is also important in case you want to know why they're having this weird back pain or knee pain. So do you have a job, for the way you would say it? So anything in Arabic to ask present tense, you start with the bit, means do you. So تشتغل means do you work. شغل is job. تشتغل means do you do the action of a job. So do you work? What do you do means to ask what do you work in. That's another way to ask it. So shu means what. شغلك goes back to the word that I mentioned earlier. شغل is a job. So شغلك means your job. So shu شغلك. It sounds like a shoe, like the shoe that you wear. So if that's an easy way to help you remember it, by all means, use it. So some of the, obviously, this is not an exhaustive list, but this is some of the professions that you might be hearing about. So a doctor is tabib for a male and tabiba for a female. Teacher, muallim or muallima for a female. You can kind of see a trend how for females there's an sound at the end, and for males it just ends there. And it's pretty universal, I believe, in Spanish or other languages. They do have the changes in the sound for feminine versus masculine names as well. Engineer, muhandis or muhandisa. Student, talib or taliba. Nurse, mumarrid or mumarrida. Lawyer, muhami or muhamiya. Chef, طباخ or طباخة. If you'd like to know how to say your profession or other employments, comment down below and let us know, and we will help you. We'll include it in our next video, or we will help you learn how to pronounce that.
Okay, so more psychosocial history questions. We always want to make sure the patient is feeling safe at home and work, and we want to ask about their life stressors. They can help us get a better idea of their overall health and what they might need. Okay, so do you feel safe at home? Is بتحس بأمان في البيت, and then work means شغل. So just to break it down a little bit, بتحس translates to do you feel, بالأمان is safe, في is at, البيت is home, الشغل is work. So just one more time, بتحس بأمان في البيت or بالشغل. And then, do you have any life stressors? عندك أي ضغوط. So ضغوط translates, the direct translation would be pressure. But in this context, if you were to say that full sentence, the patient would understand that you're asking about life pressures or life stressors. So عندك means do you have, A means any, and ضغوط means pressures or life stressors. Okay, and then like more specifically, if you want to ask about financial or family stressors, financial means with mean maddiya. So ضغوط maddiya is like financial stressors. So the full sentence for that would be عندك أي ضغوط مادية. And then if you want to ask about family specifically, family translates to عائلة. So it would be ضغوط عائلية. So the full sentence for that would be عندك أي ضغوط عائلية.
Okay, and a big part of specifically Arabic-speaking patients' daily life and psychosocial history is religion, because the majority, and not everyone, is spiritual, or they find some sort of like healing in their spirituality. So it's always good to ask, just to keep it in mind, not only for when you're talking to them, but also in considering treatment options for them, because sometimes it does have an impact on how you treat them or some of the modes or things they would like to have, like in terms of resuscitation or end-of-life care as well. So to ask someone if they are a spiritual person, you would say inta means are you, mutadayyin means religious or spiritual. So inta or inti for a girl, mutadayyin or mutadayyina. Inta, mutadayyin. And then they would tell you yes or no, which if you recall from an older video, we said that's na'am for yes and la for no. And if they say yes, then they would elaborate. So Muslim, it's the same way. So Muslim. Jewish is Yahudi. Christian or Catholic would be Masihi or Masihi, if that's an easier way for you to pronounce it. And Catholic would be Katholiki. So it sounds pretty similar to it, Katholiki. For on top of just asking if they're spiritual or not, you also want to learn their habits, and we'll be discussing further alcohol, sleep, diet, exercise. But in this section, we're going to be talking about alcohol specifically. While there is an assumption that a lot of Arabic-speaking patients are Muslims who don't consume alcohol, that cannot be something you right off the bat assume. So you still would like to ask patients just to know their habits and to know how that could be impacting them. Maybe they're having a right upper quadrant pain, and that's due to liver failure because they consume alcohol. So you always want to make sure you're asking these things. So to start off by asking, do you drink alcohol? تشرب, again, going back to the BT, the action of the present tense, do you do? So بتشرب كحول, كحول is alcohol. تشرب, do you drink? So do you drink alcohol? تشرب كحول. How much do you drink weekly? كم means how much. تشرب, again, the same word, do you drink? أسبوعيا or أسبوعيا is weekly. So كم تشرب أسبوعيا is how much do you drink weekly. And there's here, again, this is not an exhaustive list, but just a list of some of the most common drinks that people have. So beer is bira, wine is khamr, whiskey is whiskey, no surprise there. Rum, vodka, and tequila are pretty much the same thing. So we would just pronounce them a little bit differently, but the patients, you would probably be able to pick up on what the patient is saying. So rum, vodka, and tequila.
Okay. So you also want to ask about smoking. So do you smoke is bidakhan. And the root of that word is dukhan, which means smoke. So when you say bit, like Fatma explained a few minutes ago, that just is asking, do you? So bidakhan would be, do you smoke? And then if they say yes, you want to ask about like how much. So kem bidakhan yawmiyan. So kem is how much. Bidakhan is do you, and yawmiyan is daily. So kem bidakhan yawmiyan. And then some more terms, cigarettes. I apologize for that. Cigarettes would be sigarat, or you can also hear jigarat, but I think the ending is similar though. So sigarat or jigarat. And then a pack would be baket. And then hookah, there's like multiple terms for it. We just have the two most common ones here. Argila or shisha.
Okay, so as you know, in this day and age, the use of drugs is very common and very versatile. So a lot of people use different kinds and different types. So it's important not to only ask patients is do you use drugs, but also to kind of be a little bit more specific in case they're a little bit hesitant on sharing. If you ask a little bit more specifically, some things to some patients may not be considered drugs. So when you ask specifically if they're using this specific drug, it could help you get a better idea of what's going on. So again, back to the BT, PIT. PIT تستخدم means do you use. Al-mukhaddirat means drugs. And the direct translation for mukhaddirat is actually sedatives, even though that's not what it means or that's not what you're asking for, but that's kind of like the root of the word. So تستخدم المخدرات, do you use drugs? And then marijuana is marijuana. Cocaine is cocaine. Heroin is heroin. So as you can see, it's just the same thing and you just say "een" at the end. Meth is meth. Qat is this is a specific drug. You may not have heard of it, but this is a plant that specifically grows in some regions of the Middle East. And so you might hear some of the populations using that specifically as compared to the drugs that you're usually used to hearing here in the population. So it's good to ask about this one. So qat or qat. And there's hashish. It's exactly as it says. It directly translates to grass, but it's usually the versatile term that people use. It's like the slang term for doing drugs. So if someone says they do hashish, don't just, it's not a specific type of drug. It could mean any of the above. It's just the way they use to describe it. So that's another way that just familiarize yourself with it.
Okay, moving on to exercise. Bit marran. So bit marran. Titmarran means, or sorry, tamreen means exercise. So that's the root of this word. And then as we've explained, adding the bit part is just asking, do you? So bit titmarran. And then you want to ask like how often or how many times a week. So kam marra bil isbu'. Kam means how much, or like how many. I think we saw this one when we were asking like how often do you smoke? So it would be kam, and then marra is times, and then bil isbu means per week. And then they might run, lift weights, walk, or do other things. So if you're interested in learning more terms, just leave it down in the comments. So I run, barcode. I lift weights, برفع أثقال, and then I walk, بمشي. And then sleep, one of my favorite activities. How many hours do you sleep each night? So kem, again, how much or how many. Sa'a or sa'at means like hours or hour. So in this sentence, it would be read kem sa'a. Bitnam, do you sleep? Bilyom means per day. So kem sa'a bitnam bilyom.
Going on to more fun things, or my favorite activity is food. So we're going to be talking now about diet. What do you typically eat? You want to know about what the patient is eating to know if they're having any nutritional deficiencies or if they're a little bit overweight. You want to kind of work on that with them. So it's a very important thing to know how to ask. So shoe, again, that word that sounds like a shoe that you put on your foot. Yeah, shoe is what? بتاكل بالعادة. بتاكل means to eat. Bit is the verb, the present tense. تاكل means to eat. بالعادة means usually. So شو تاكل بالعادة. And this is just, again, not an exhaustive list, just some of the things that are most common. So fruits is فواكه. Vegetables is خضروات or خضرة. You might hear either of those. Carbohydrates is carbohydrate. Fats is دهون. Protein is protein. Sounds very similar. Vitamins is vitamin, also sounds very familiar. And water sounds like, the way you write it sounds like may, but we say it more like might. So it's also important to ask the patients how much water they're drinking. If you have any favorite, again, if you have any favorite foods, favorite things you would like to know how to say, ask about apples, ask about oranges. We're more than happy to answer that. Put it in the comment section or message us directly and we'll be happy to provide you with those informations.
Okay, so that wraps up our Arabic lesson for the day, but we also wanted to incorporate some culture, just so that everyone's aware and we can take better care of our patients. Okay, so we're going to start by talking about how important the family dynamic is to the majority of Middle Eastern patients. Obviously, we can't put a blanket statement on every single Middle Eastern or Arabic speaking patient that's going to come in to the clinic, but just generally, family, it plays a really, really big part in our lives on a day-to-day basis. And so the way that that can maybe translate into a more clinical aspect is a patient might come to their appointment not alone, but with not just one family member, but multiple. I know I myself always like take one of my family members with me, and it's really, really common to see multiple family members with these patients. And something else that's important is sometimes the patient might not want to make a decision on their own. Sometimes they might want to consult with their family member that came with them that day, or they might even tell you, can I go home, discuss it with all of my family, and then come back and tell you my decision at a later time. And family homes in our culture are multi-generational. So this means that grandparents, from grandparents to like grandkids, will live under the same roof. And it just is like, if you can know this and make the patient feel comfortable with this, then it just is going to go miles when you're caring for them and for their overall health, and they will respect you and trust you a lot more. So we just wanted to put this so that everyone's aware that family is a really, really big role in our lives and plays a big role in our health.
So while this second topic may not be as related to the previous one that Arun was talking about, since we are at the psychosocial interviewing of the patient, it's very important to be attuned and observant of the patient's needs. And while caring and understanding how that family dynamics work, you also should understand the needs of the patient. OB-GYN is always a place where people feel very vulnerable, like OB-GYN patient visits. Not just for Arabic speaking patients or Muslim patients, it's generally for all of the patients, even people who speak English and people who have lived in the States for their whole life. So it's very important to try to make the patient feel as comfortable as you possibly can. Just we're talking about this because it's usually patients following the culture as well as the religion. Female patients would prefer to be seen by female healthcare providers. They prefer to be one-on-one versus having multiple people in the room, which sometimes is the case, not always. They prefer to be covered for the majority of the time. They prefer to have their privacy. So it's always important to, not just for Arabic speaking patients or Muslim patients, it's always important to be asking those questions. What makes you feel comfortable? Do you want someone else to be present in the room? Do you want an extra blanket that I can cover you with while I'm not examining you directly? And also understanding that while examining the patient, you want to try to be as quick as possible, obviously as needed to examine them. You don't want to speed up and then end up messing up or hurting them. Obviously, you want to take your time with the physical examination, but at the same time, only uncover them when needed and make sure you're always attuned and understanding of what their needs or what they could be telling you, because a lot of times, unfortunately, most of those patients have gone through so many difficulties by seeing healthcare providers. So sometimes they're afraid to speak up and will compromise their comfort just to not look bad or not to be judged. So make sure you're always proactive and always asking. Don't just wait for the patient to ask you. And on top of that, to continue this discussion, something that I personally have heard about a lot is the pap smears and how difficult it is for patients to communicate to their OB-GYNs or to primary care doctors about the differences in cultural expectations. So pap smears are uncommon in Arabic-speaking populations, not just Muslim patients. In general, Arabic-speaking populations preserve themselves, for females specifically, they preserve themselves till marriage. This is, again, does not apply to every patient, but you should not assume that everybody feels comfortable getting a pap smear. So you always want to talk to the patients and try to understand where they're coming from. So pap smears is a very common checkup in the US, but many people in the developing world will only go to the doctor if they need to. So they're not used to the checkups. And also, it is a component of preserving themselves until marriage. So getting the pap smear could compromise that. While medically speaking, that may not make sense. And you might think we're not really doing anything outside of like just exactly what you need to come to diagnose the patient or to treat them. But to those patients, you have to understand that it does carry a lot more weight than it might appear to you. So you always want to be aware that those patients may not want to get a pap smear. So you still want to offer it, you still want to talk them through it, and then try to understand their perspective, why they're saying no, and just keeping in mind that that population usually tries to avoid getting a pap smear until they are active, which in most cases only until they're married.
And so it's just important to, like Fatma said, understand where the patient is coming from and most importantly, not pass any judgment and just keeping the patient's health at first and foremost.
Absolutely. So thank you all so much for tuning in today to our video. We hope that you were able to gain some knowledge or have a little bit of fun, learn something new that you did not know before. We really appreciate you tuning in, listening to our videos and learning from them. And if you have any comments or questions, feel free to reach out to us via our email, which is in the description box below, or just put it in the comments section. Share this video, share our channel with the people that you know are interested in Arabic, even people who are not. Just let's all try to be culturally competent physicians or healthcare providers as much as we can. Thank you so much again, and we hope to see you in the next video.